let's talk about breast augmentation.
Yes.
So you say it's about 50-50 right now.
I think right now it is. Yeah.
Okay.
Yeah.
Alrighty. So, what are ladies thinking about in terms of breast
Yeah.
augmentation? What kind
So,
of questions or what are their thoughts?
whether they have a little bit and they want a little bit more,
Right.
that
I
is always
understand.
one
Right.
of the things. Or they've always been smaller
Mm-hmm.
chested,
Mm-hmm.
and they want to have some sort of enhancement. They want
Mm-hmm.
to, whether they want to. It always changes. They come in and they say, "No, I don't want to be too big," and then they try on things. They're like, "I like the big," so it changes, and so it's
You know,
always funny. Yeah.
you're right. That's very interesting. I have learned how to quit guessing what a woman wants in terms of breast augmentation, in terms of size. So it does have the highest satisfaction rate, they say, of all cosmetic procedures, and it tends to be people who feel that their breasts are small, they can't fit into clothes they would like to wear, or they feel that, hey, I've got wide hips and I have just very tiny breasts and a narrow chest, and I don't feel like I'm in proportion. They feel like they're two in one body, those women. And then, of course, there are the ladies who just want to kind of have that aesthetically more buxom look. It's amazing how somebody walks in and you might think, oh, they're going to be modest and they want to go big, like you said,
Right.
or somebody who really you think, okay, this is sort of a body kind of personality, really out there. She's going to want to go big, and they are fairly modest and they go small. So I've almost learned now not to guess and let the patient tell me what they want.
Right.
So in terms of breast augmentation, and I'd like to cover kind of the recent trend, which I'm very excited about. But what do we have them do if they're not sure? They know they want to be bigger, they want to be augmented. What do you have them do before they come in for a consultation?
So it's always important to kind of start thinking of what size or how big. So
Mm-hmm.
we have them do a rice bag test.
Okay, so what's a rice bag test?
A rice bag test is exactly that. You buy some rice.
Okay.
Get some baggies, some produce baggies,
Okay.
and you fill them up with some rice.
Okay.
And we start at a cup or half a cup.
Right.
And you can play with the sizings, and then you put them in your bra.
Okay.
A sports bra,
Okay.
nice type bra, and you walk around the house and you see what they feel like, what you like, what you don't, and that kind of thing.
Okay. All right. So the rice bag test. So there are 8 ounces in a cup, and an ounce is approximately 30 mLs or 30 cc's. So you're looking at 240 cc's in a cup, and filling them up and walking around, and actually it sounds totally hokey.
Right.
And if you're listening on our YouTube at Dr. Walter Thomas and you're looking, well, he's Asian, that's why he's picking rice, has nothing to do with that. This has been around way before I started doing cosmetic surgery, but it's really surprising how accurate it is when women figure out, I want to be a cup and a half size, and they come in and we have implants that they try on and with a tight t-shirt on to kind of get a sense of what their body figure would look like, how accurate it is. Yeah, it's pretty funny how that happens. So, Karina, have you seen and again, we have the swings in terms of, people who want to be really large breasted and some who want a modest increase in size. Have you seen any trends in the 5 years that you've been working with me as a surgical tech and now as our surgical liaison? What kind of trends have you noticed?
Yeah, it varies, but recently we've been having women who want more of a modest enhancement, or they're not necessarily wanting to be super large. They actually want to be more on the smaller chested, but just fuller for them. So, yeah.
So they want a modest increase, and I know that on social media it's called the
ballerina breast.
The ballerina breast, exactly. And it's so where you get a modest increase in size, and for me, trying to understand the pain of the patient, or what do they want. What I see is that a lot of these women are trying to reclaim their femininity. Okay, maybe they've had children, their breasts have deflated, they want it back, or maybe they've always been very small chested and they want it to feel more whole, more feminine. And so, but they don't necessarily need to be huge. Okay. And so this move towards the ballerina breast, I think, is really nice. So we're talking about smaller implants, and it's something that I'm so excited to be introducing to. It goes hand in hand with what we've been doing all along for the last 20 years, but is what we call a tissue preservation technique And that tissue preservation technique is done under local, and that's how we do all our operations, right? And what we do is we actually will place these implants on top of the muscle, so we're not disrupting the muscle at all. We're not interfering with the function of the muscle. There's a little fascia layer, a little fine layer of connective tissue on top of the muscle. And so we lift that up and we can slide the implant between the muscle and this layer of fascia. And what I like about this is how natural it looks. It actually gives a beautiful natural enhancement to the breast. And if you've noticed on your breast, and we can always be a little unkind to ourselves, Karina, but over here on this breast, I see it's kind of flattened here, and over here, this looks a little more bulgy and so forth. If you're able to have the appropriate size implant on the appropriately selected patient, when the implant is actually on top of the muscle below the fascia, it actually makes the breast conform more to the implant itself. And so it actually helps to soften all of those things that a patient might be feeling insecure about. So I actually think aesthetically that it's even prettier and more attractive for the patients to do this technique of what we call subfascial. So it is on top of the muscle. We do not disrupt the muscle itself, and it gives you a more natural, enhancing aesthetics for the breast. And in fact, I think it is superior to the other techniques. Now, do we still put implants underneath the muscle?
Yes.
We do. And what subgroup do you think that we do that procedure under the muscle?
Someone who's very small chested, they're very petite, or they don't have enough. They're actually just smaller chest. They don't have enough to cover the implant.
Right. Okay.
So I think that, or someone who's going very large, picking a bigger size.
Bigger size. And we just saw that. We just saw a young lady, a delightful lady, and she ended up wanting to go a lot bigger than she realized. What she did on her rice bag test. She's one of the ones that the rice bag test actually way underestimated it for her. And so we talked about it. My hope was with the initial implant size that she picked, I could go and do the ballerina technique, or what I'm going to call the tissue preserving technique. But because she's going so big, we have to go underneath her muscle. And I think that she'll do much better that way. And so we individualize our approach to the different patients. In terms of somebody who's petite, if you're petite and you want to go bigger, and whatever's most appropriate for what your wants are. If you're going to go bigger than what I see surgically, I have to go by certain surgical and anatomic principles, then even if you said you wanted the tissue preserving technique, I would still probably recommend going underneath the muscle. Okay. So it's really exciting. And I love actually that mainstream cosmetic surgery is moving in the direction of what we've been doing for the last 20 years of doing procedures under local anesthesia. Because in my opinion, the patients have less post-operative pain. The patient's recovery is quicker. They return back to recovery quicker. I think it's a wonderful way with minimizes risk of breast augmentation, and most of our patients are very happy they chose that approach, right?
Yes, all of our patients are very happy, and I think that specifically, like someone who is older, 74-year-old, she specifically said, I'm only even considering this because I know that you guys do this under Tumesa, and I will be awake. So, that moms who are worried, they have little ones at home, those kinds of things, or patients who've had not a great experience with
general anesthesia. So again, I mentioned earlier in the show that I was a general vascular transplant surgeon. So, I know great anesthesiologists. General anesthesia is awesome. When I was doing a kidney transplant, we had to do it that way, abdominal aortic aneurysm or colon surgery or whatever the surgery I was doing. We need general anesthesia. But for a lot of cosmetic procedures, we can do them under local. It takes the appropriate patient who is desirous to have that approach, somebody who trusts us, takes us educating the patient, going slow, being patient, having a team that is geared to understanding how the procedures are done under local. And it is a phenomenal way of taking care of patients and achieving the look that they want. So,
and Karina, remember, it's almost like a spa day.
Because
to
you get
listen
the
to
head
your favorite
massage, you
music.
get to listen to your
The nurse
music.
massages your head. The
Right.
bed is warm.
Absolutely.
Yeah, it
Yeah.
almost is.
It is. I have many patients who will say, wow, I didn't realize it was that great.
Yes.
So, Karina, I know our time's running out. I want to wish you a happy New Year. I want to
Happy New Year
wish
to
Jeff a
everyone.
happy New Year, and all of you, thank you for listening in to Ask the Expert with Karina and myself. I'm Dr. Tom of Dr. Tom Cosmetic Surgery.
Thank you.